Thank you. We'd like to thank everybody for attending this afternoon's press conference. I'm P.J. Wendell, Chautauqua County Executive. This afternoon, Chautauqua County Department of Health and Human Services Public Health Unit was notified of 2 residents in Chautauqua County who have tested positive for the COVID-19 virus, a disease caused by novel coronavirus. These cases were confirmed through testing at the ACL laboratories and are the first confirmed cases in Chautauqua County. The 2 individuals were diagnosed with COVID-19 include a female in her 30s who resides in the Dunkirk area with recent travel to the city of Buffalo. The second, a male in his 30s who resides in Silver Creek area with recent travel to the city of Buffalo as well. Based on initial review of each case by the Department of Health epidemiology staff, these individuals appear to have had separate exposures to the novel coronavirus. Both of these individuals have been in precautionary quarantine by the Department of Health. As of this date, neither individual has required hospitalization. Each will continue to recover at home under mandatory isolation per New York State Department of Health guidelines. Chautauqua County Public Health staff has begun an intensive investigation to identify those close contacts of these 2 individuals. Once identified, our department will notify the close contacts of their potential exposure to COVID-19, and they will be placed under mandatory quarantine to monitor for symptoms. There is a national shortage of personal protective equipment, PPE, collection swabs, and viral transport media supplies, and it is critical that laboratory testing be prioritized for hospitalized patients and the very sick. It is critical that we protect our healthcare workforce. Any resident experiencing a fever with cough or shortness of breath should call their healthcare provider first for guidance. Do not show up at their office, urgent care, or ER before calling. Only if your symptoms are severe, call 911, and the 911 dispatcher will screen your call as per established protocol. We will continue monitoring the situation and update the public on a regular basis. Visit chqgov.com or www.facebook.com/myhealthycounty or call 1-866-604-6789 for more information. At this time, I'm going to turn the microphone over to Christine Schuyler, our Director of Health and Human Services in Chautauqua County.
Thank you, County Executive Wendell. This confirmation is not a surprise to us. As we have been saying, my full assumption has been that the coronavirus is spreading and around in our community. The lab confirmed cases just give us that official confirmation of what we have been thinking and what we have been preparing for. I fully expect to see more positive cases. We have several cases pending at various laboratories. As soon as we receive positive results, we will again update the media and the public as we go forward. I continue to ask that you abide by the guidance that's there, washing your hands frequently with soap and water for at least 20 seconds. If soap and water is not available, use hand sanitizer with at least 60% alcohol. Avoid touching your eyes, your nose, and your mouth. Avoid close contact with people who are sick. Stay home, please, when you're sick. Cover your cough and your sneeze with a tissue or cough into your elbow. Clean and disinfect frequently touched objects and surfaces. Very importantly at this time, this is a pandemic. Distance yourself from others. We ask that you maintain 6 feet between yourself and other people and avoid any sort of gatherings. For more information on social distancing, we do have some information for the public that we will disseminate. Very nicely done. Where to avoid, what to use caution, and what's safe to do. We also are reminding you to please get a flu shot. A flu shot is not going to prevent COVID-19, but it can absolutely help to prevent influenza and keep you healthy and out of the hospital right now. We continue to have a shortage, statewide, nationwide, on testing supplies for COVID-19, as well as personal protective equipment. If anything, finally, having lab-confirmed positive cases of COVID-19 means that Chautauqua County will go up higher on the list of counties prioritized to receive supplies from the federal and state government. If you have any further questions, you can call, as County Executive Wendell said, or visit our website or our Facebook page. Again, I would caution that you pay close attention to where you're getting your information from. Social media is running rampant with rumors and false truths. This is a time for calm, a time when we need to be mindful of ourselves, of our health, and of our community and our surroundings. We can be vigilant, but we need not be panicked. It really does not matter if you have mild respiratory symptoms and don't get tested for COVID-19. Nothing is going to change. There is no treatment. There is no vaccine. You need to stay home if you're ill, and please be respectful of others who may not be able to fight off a virus such as this as you can. Thank you.
Thank you very much. At this time, we will entertain questions.
Determine where these individuals have been? Have you done like an analysis of where they could have been when they were symptomatic?
We were just notified, the question is, have we done an in-depth analysis yet of where these individuals have been and who they have been in contact with? The answer is we were just notified of these positive results from the lab this afternoon. So my staff is working very hard right now to do that contact tracing in consultation with the state health department, going back to a time when a person became symptomatic and who they were in close contact with. That doesn't mean a contact of a contact of a contact. That means someone that they were in direct, within 6 feet, close contact with. That's a job of my nursing and my epidemiology staff, and they do a very good job of that. Anyone who is found to be positive, like we do have now, will go from precautionary quarantine, which these two individuals have been in. My nurses have followed up with them twice a day, every day. They now go into what we call mandatory isolation. And that will continue for them, as well as anyone who's been in close contact with them will now go into a mandatory quarantine.
Any other questions?
For people here in the county, what is the message that you're still trying to convey to them as we move forward with this process?
The message we're trying to convey to our residents is remember social distancing. We need to make sure we are vigilant in those actions. We need to limit group gatherings. We need to make sure that we are practicing all of the recommendations that have been put forward by the New York State Department of Health, by the CDC, and also by the Chautauqua County government. I'm committed, like I've said before, I'm committed to making sure that information gets out to the public as quickly and as thoroughly as possible. As Christine had said, we just received information and confirmation this afternoon, at which time we got the information out to the public. So again, our commitment to the residents is continue the social distancing, continue your vigilance of proper hygiene, washing your hands, but also listening to the recommendations, and we will continue to move forward. Again, I do have daily updates at 4 p.m. on my Chautauqua County government page, also my County Executive P.J. Wendell Facebook page, and if you'd like directly to get the email from my Monday morning memo, you can sign up on chqgov.com on the County Executive page under the MMM tab, and then you'll receive those daily memos at 4 p.m.
How long has the process took since the results of the test were sent to the lab to today?
So the question is, how long has it been since the results of the lab, you mean since the specimens were sent into the lab to the time we got results? Boy, let me think. The one result took 5 days to come back. The other result took, I believe, 3 days to come back, which is really good. We're seeing it's been anywhere, normally 3 to 5 days before, typically 4, 5 days before we've been getting results. So.
Is there a specific place where they're being sent?
Most of the specimens now are being sent to commercial laboratories, specifically ACL or Quest and LabCorp.
So we talked earlier about how, there weren't any confirmed cases at that point in the county, but yet people still needed to treat the situation like COVID-19 was in the community. And you had said, it would just be a matter of time before a positive case comes through. However, you go out to like Lakewood and stuff, people are all over the place. I mean, the grocery stores are packed. I mean, people are really probably here, from my observation, more running around in Chautauqua County than anywhere else I've seen. That could be maybe contributed to the fact that there wasn't a confirmed case yet, but I mean, what would you say to those people who are just making unnecessary stops still at this point?
Question is, what would I say to people who are still making unnecessary stops and gathering around who shouldn't be at this time? There I take a deep breath and say, please, if you needed to wait to hear that there was confirmation by a laboratory that the coronavirus is here because you didn't believe us when we told you that it's here, now believe it. And now, please pay attention and abide by all of the social distancing and respiratory hygiene measures that we've laid out there for you to follow. This is very serious. This isn't a simple cold that's going around. We are now at the beginning of what we've called the wave we've been waiting to come in. We're in that bell curve. The cases are going to start to go up. It's all of our jobs, not meaning health officials, government officials, every single person in this community, it's your job to help keep this illness from spreading, to help flatten that curve so that we don't have so many people so acutely ill that our healthcare workers are completely overwhelmed, either sick themselves or overwhelmed by so many cases of people who need to be seen in the hospital or hospitalized that they can't manage. We do not want to be in the place where Italy has been. That's why we're working so hard, and I really am confident that people have paid attention enough, I think, that the disease spread has been slowed here. I think that's why it's been so long since we have seen confirmed cases in conjunction with a lack of testing supplies and prioritizing who gets tested. And if it's an indication of how mild the disease has been in those who have been getting it and traveling around in the community, that also makes me hopeful. That does not mean that we could not still get slammed very hard. We could be. And that's what we need everybody's help to avoid. And I pray that that doesn't happen. We need to lower the tempo here and prevent the disease from being spread. And if that happens, it's not because it wasn't bad or it wasn't something that could have happened. It's because we all did our part to keep everybody safe and healthy.
And these cases you presume are probably community spread?
I am presuming that these cases are community spread. Neither of these individuals traveled in China or in Italy or any of the even New York City, where we've seen, a lot more cases. That, to me, is preliminary evidence that coronavirus is at the community spread level, which is what we fully expected even before we knew we had a confirmed case.
Is there a better way to enforce the idea that people shouldn't be gathering together? Because yesterday we had people reach out to our newsroom in Jamestown and say that churches were still gathering, and albeit they were taking steps, people were still together in one room, an arm's length away.
The question is there any better way to enforce the social distancing and community gathering recommendations that are out there? I have a lot of respect for our faith leaders. I'm hopeful that they in particular can help to spread the message that this is now not the time to gather. And even though you may feel personally that the Lord is going to take care of you, and if you get it, you get it, if you don't, you don't, that's really not some dice that you want to roll. because we personally impact everyone else around us. So it's very important that we pay attention to this. This is not a time to say, I can't go down to the local tavern and hang with my friends, so instead, all of my friends are going to go gather at my other friend's house and we're going to have 25 of us there. That's not what this means. It's not change your venue. It's stay home and take care of yourself and your loved ones and take the precautions that you need to take.
Any other questions?
PJ, for businesses that are still open, who are deemed essential, what should they be doing to continue to do their part to help stop this?
We just had a conference call at 1 p.m. There was another one at 3 p.m. The 1 o'clock conference call, several of the large manufacturers are already implementing plans and are starting nurses' stations. They will be screening their employees when they come to work, taking their temperatures, asking if they have any symptoms of the illness, at which time, if they do, they will be taken care of as far as following up with their primary physician or et cetera. But our local businesses, the ones I spoke to at 1 o'clock, have already implemented these strategies, so we're going to urge other businesses, if you are open, that it is the responsibility to please screen your employees. And again, as we have always said at the beginning, if you feel sick, do not go to work. Then call your doctor and follow up with your primary physician. But we are our best help right here. We need to realize that, as we said, the cases have now been confirmed. Will this help people to realize and stay home and pay heed to our warnings? I would hope so. And with that said, our industry that is open are taking those measures to make sure that their workforce is healthy and they are being screened as they come in.
With the confirmed cases, is there any greater chance that we could start to see more test kits come here, more assistance here?
That's, the question is, with the confirmed cases, will we see more assistance and more test kits come here? We have had test kits here in Chautauqua County. We have been actively testing right along for the last week. Will this move us up on the priority list? That is my belief. I'm on daily conference calls with state leaders at 2:30 in the afternoon and again at 7 p.m. at night. And we follow up to find where we rank, I guess you would say. And up until now, we have not had cases. So now that we have had cases, my hope is that, yes, we move up that ladder a little more than we had in previous days. But again, that's, the state has made its obligation to those most heavily impacted. That is where the efforts are going to be. But I feel good right now, and I feel confident that, with these confirmed cases, that we will start to see more assistance coming our way. Yes.
Do you have any numbers of how many tests you have?
What do you,
Do you
the
have
question, how
any-
many tests, you mean how many tests, ability to test or how many tests are out there?
ability to test.
I honestly don't today, been a little busy, but I know that all of our hospitals do have some testing supplies and private healthcare providers do have a limited supply, as well as our federally qualified health center, the Chautauqua Center. The best thing we can do is you need to call your healthcare provider, discuss your symptoms with your healthcare provider, and then if they deem that it's necessary for you to be tested, then they will refer you to where you can get that done.
Is it still at this point up to healthcare providers to make that decision whether they should be tested or not?
Yes, it is. The question is it up to healthcare providers to make the decision whether or not someone is tested? Yes, just like anything else, the testing that your physician recommends is up to that clinical provider. There is guidance out there on how to prioritize patients during this pandemic. It's not business as usual, and it's not healthcare as usual during a pandemic. Things are triaged differently, and resources are allocated differently. That's what we have to do.
I'm sorry, I just had, it's just a question about, and this is not specifically a Chautauqua County issue, but maybe as a healthcare professional, you can weigh in. Really, if you go somewhere and say you're trying to practice social distancing, stay 6 feet away from someone, but they come close to you. It's a hard thing that I think a lot of people are dealing with right now, and people don't want to be rude and say, well, can you back up or anything? But I mean, what advice do you give when everyone's kind of trying to do that, but you know, some people might not be abiding by it or really, I guess, just assume that everyone wants you to stay 6 feet away from them. It
Yeah.
may seem like a silly question, it's not even a question, but it's
No.
something I personally experience, you know?
Yeah. In a nutshell, the question or comment was, what about people who invade your personal space and want to come close and you don't want to be rude? I would say it's a pandemic, so go ahead and be rude, honestly. We have our personal space and it's there for a reason. And there's nothing wrong with protecting yourself at this time and educating them at the same time as to why it is important to maintain that 6-foot space, you know, and I see no reason to not do that.
It's something I've experienced.
Oh, absolutely. You know, and I'm a
Out and about.
I'm a hugger. Anyone who knows me, I'm very friendly and outgoing, and now is a time where we really have to, you know, stay away. Keep your distance. It's okay at this time with what we're seeing in this world and in this nation. We need to keep distance. Another question was on people who have second homes here or vacation residences within Chautauqua County. We're not unique in that we have a lot of snowbirds who live here that go to Florida or Arizona or other warm places for the winter. And we also have people who live in other areas of either the world or the nation that come back to Chautauqua County normally for the summer. There is no limit on travel when you have your own property. We are asking for people to avoid non-essential travel, but there's nothing prohibiting people to go to one of their residences. Now that means we ask anyone and everyone who's in this county, anywhere right now, to please be mindful of the guidance that we've given to everyone else. Everyone needs to be very careful, to try to isolate themselves, remember the social distancing standards, and if you're here and you become ill, notify your healthcare provider. If you don't have a healthcare provider within the county, then we at the health department or at the county health network can help you to find a primary care provider.
And to follow up with that, we have received a lot of questions into my office, and we have been in constant consultation and communication with Chautauqua Institution, Lilydale, and other seasonal communities as part of our COVID-19 response team, and we're working collaboratively to ensure that those serious messages are shared with them. One of the things we need to remember is Chautauqua Institution does have a sizable population that lives there year-round. And one of the questions we had was, there was a lot of traffic in and out of the institution this past weekend. And after talking with President Michael Hill, many and most of that traffic were county residents coming into the grounds of Chautauqua Institution to walk and get a little bit of exercise. So they have taken measures on the grounds of Chautauqua. There is a questionnaire that he has sent out to their residents if they are coming back into the area to fill that out and please get it back to him. So again, Michael Hill and I are in constant contact, and also Joe Gerasi is part of their police force. We will be in contact with them, making sure that if those numbers rise, we are going to get a really good handle on the numbers as if and when. But right now, I did speak with Mr. Hill, and he said there are about 20 more people than are usually there this time of year. So there is not a great influx as we've been hearing. We are not providing transportation for residents of New York City to come to Chautauqua Institution to get into their homes. A lot of that information is coming out there, but we are in constant contact, and we will remain as this unfolds. And it's a moment by moment, and the word we've come to be a little bit more accustomed of is fluid. This is a very fluid situation, and it changes hour by hour. So as Hannah said, we were here at 12:30 and there were no cases. By 4 o'clock there were. So that's just how this is going to evolve. But again, we are committed to my COVID-19 response team and I. The plan we have in place is effective. It is now implemented. We hope that all of our residents pay heed and follow our social distancing guidelines. And now that we have a case there, maybe people will step up their own efforts and we'll keep moving forward. But there will be daily updates at 4 p.m. this evening. I have a conference call with all mayors and town supervisors throughout Chautauqua County to answer questions, keep them updated and apprised of our situation. So We've said it before, we're CHQ strong, and we're going to get through this with unity and a collaboration of effort, but we urge everybody now to do the right thing, remember our social distancing, and take care of your neighbors. Any other questions? If not, thank you, everybody, for coming, and we will keep you updated as situations occur. Thank you.